Welcome to Bipolar Talks, a safe and honest space where we explore the reality of living with bipolar disorder. Openly, compassionately, and of course, mindfully. Before we dive in, please don't forget to like, comment, subscribe, and share this video if you find it helpful. Together, we can spread awareness and reduce the stigma around mental health. At 21, I was a senior at Brown University. On the outside, everything looked perfect. I was thriving as a Division I college athlete, surrounded by brilliant friends, and with a perfect 4.0 GPA, I was preparing for one of the nation's top medical schools. Sounds like a dream life, right? But hold on, this is just the beginning of the story. Then suddenly everything changed almost overnight. It was like my brain had been hijacked. Just a week before, I had aced a calculus exam. Now I couldn't even add 2 plus 3. Getting out of bed became a mountain. I locked myself in my room, terrified to see anyone. Ever felt like your world crumbled without warning? If so, you're not alone. What followed was a terrifying descent into a life-threatening brain disorder. And I kept it secret for nearly 40 years. But tonight, I'm sharing my story for 3 reasons. To erase stigma, to save lives, and to optimize healing. Curious how this story could save lives? Let's go deeper. It took 25 years and 5 psychiatrists before I was finally diagnosed with a condition that changed my life forever. Bipolar II disorder, part of the broader bipolar spectrum. Never heard of the bipolar spectrum? You're not the only one. Most people don't realize that bipolar disorder isn't just one thing. It exists on a spectrum. Understanding this spectrum, including the difference between bipolar I, bipolar II, and unipolar depression, can literally save lives. Ever felt low, unmotivated, or unable to get out of bed? You go to the doctor, and they give you an antidepressant? If you're like me, someone with bipolar II, that medication might not help. It might actually make things worse. Here's a chilling truth. People with bipolar disorder are twice as likely to die by suicide than those with unipolar depression. That means getting the right diagnosis isn't just about health, it's about survival. Want to know how many people this affects? Let's look at the numbers. According to Dr. Holly Schwartz of the University of Pittsburgh and NIM data, 1 in 4 people who seem depressed are actually bipolar. About 7 million Americans live with bipolar brains each year. And at least half fall somewhere on the spectrum. But the real number might be much higher. Why? Because of stigma and misdiagnosis. On average, it takes 11 years to diagnose bipolar II. That's 11 years where lives can fall apart. Into addiction, homelessness, even incarceration. So yes, recognizing the signs early really matters. Let's keep going. Why is bipolar so often misdiagnosed? Because when people hear bipolar, they picture the extremes, wild mood swings, impulsive behavior. That's bipolar I, classic mania. But people with bipolar II, like me, don't experience full-blown mania. Our symptoms often look like depression, exhaustion, hopelessness, darkness. And so, we're often misdiagnosed with major depression and given medications that make things worse. Ever taken medication that made you feel worse instead of better? Now you know why. A major study by Dr. Jim Phelps and his team found that psychiatric patients in primary care often receive 8 different medications, some even up to 27. Imagine years of being on the wrong medication, with side effects that only deepen your suffering. I was once given a medication that made my brain feel like it was trembling inside my skull. The doctor thought I was getting worse, so they increased the dose. It became a vicious cycle. Ever felt like your doctor didn't quite get what was going on with you? You're not alone. But there is hope. After 25 years, I finally found a psychiatrist who truly understood the bipolar spectrum. He gave me a simple 11-question test, and within 15 minutes, identified that I had bipolar II. That diagnosis saved my life. The right treatment calmed my brain and gave me back myself. Want to know what it feels like to live with a broken brain? Let's walk through it. When my brain crashes, simple things become overwhelming. Unpacking 2 grocery bags can take me 3 hours. Shopping in a grocery store feels like a battlefield. Too many choices, too much noise. Even folding clothes or putting away laundry can feel impossible. Everything piles up, on the outside and inside. Ever felt paralyzed by things that should be easy? You're not the only one. I share this not to make you sad, but to let you know. If any of this sounds familiar, you are not alone. There is hope. There is help. And sometimes that help starts with one person who cares. We're in the middle of a mental health tsunami. 1 in 2 teens struggles with anxiety or depression. Suicide attempts among teen girls are up 51%. Did you know you could be part of someone's emergency mental health team? Here's how. 1. Don't wait for them to ask for help, you reach out first. 2. Listen without judgment, sometimes just sitting with someone is enough. 3. Do small things for them, drive them to the doctor, help with laundry, or just help pick peanut butter at the store. 4. Build a team, you don't have to carry it alone. Invite friends and family to share the load. You can break the shame that keeps so many suffering in silence. As Terry Cheney once said, this disease thrives on shame. Shame thrives on silence. And I won't be silent anymore. If your friend is embarrassed to see a psychiatrist or refuses to take medication, remind them, this is not their fault. If you have diabetes, you take insulin. If you have heart disease, you take blood thinners. The brain is a physical organ too. It's time we stop treating mental health like it's invisible. If you want to help, I'll leave you with a simple framework. PECS. Physical, emotional, creative, spiritual. These are 4 daily practices that support brain health. Every day, try one thing in each category. Physical, take a walk, ride a bike, dance. Emotional, talk to a friend, share a laugh. Creative, cook, draw, sing. Spiritual, meditate, pray, spend time in nature. This isn't luxury, it's survival. And it's not just for people with bipolar. It's for anyone with a brain, living in a stressful world. So from one human to another. If you're struggling, don't give up. If you see someone struggling, don't turn away. Let's be part of the change, because love, understanding, and mindful presence can truly save lives. Thank you for listening to this episode of Bipolar Talks. If this touched you, please remember to like, comment, subscribe, and share so others can benefit too. And finally, an important disclaimer. The content shared in this podcast is for informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you or someone you know is experiencing depression or any other mental health issues, please consult a licensed mental health professional. Always seek the advice of your physician or qualified mental health provider with any questions you may have regarding your mental health. See you in the next episode, and until then, take care of your mind and heart mindfully.